Yes, because people just think, high sugar, low sugar. It's not just the number. Okay, sugar is it's all a body disease. It has influence in every part of the body, every metabolic aspect of the cell. So low sugar, instead of saying it as the numbers, usually low sugar is more dangerous than the high sugar. If patient goes to hypoglycemia, especially if you are awake in the daytime, to compensate this low sugar, the sympathetic system, we get adrenaline, noradrenaline, these sympathetic hormones are released. What happens in daytime is that may produce adrenergic surge, like toxins. So they produce ventricular ectopy, and they prolong certain cycles, certain electrical properties, like prolonged QT interval. This can trigger fatal ventricular arrhythmias, especially during hypoglycemia in the daytime. Whereas in the nighttime, when we are sleeping especially, that sympathetic system may not be so active to compensate. That's why we suffer more. So these low sugars may trigger abnormal impulses, abnormal current leaks known as ectopics, maybe ventricular ectopy, atrial ectopy, and atrial arrhythmias are more common. So either way, the low sugars are definitely dangerous, and these will alter the metabolic milieu and certain fluctuations in the sympathetic and parasympathetic imbalance. So these may produce fatal ventricular events. That's why, especially if there is this autonomic imbalance, may it be diabetes, hyperglycemia, hypoglycemia, or autonomic neuropathies, high incidence of arrhythmia sometimes can be fatal than non-diabetics.